Thank you for your interest in learning about patient activation through community conversations, or PACCs. PACCs were developed by patients for patients to make people more involved and informed when they use the healthcare system. PACCs is a program of Pulse Center for Patient Safety, Education, and Advocacy. This presentation should help you understand what a PACC is and hopefully answer any questions you may have. PACCs are appropriate for people with similar diseases or conditions, people who are of similar age, such as older adults, office staff after work as long as there's a quiet place to meet, faith communities such as churches or synagogues, neighbors, friends, and family can hold a PACC, and this is a great way for people to get to know each other better. Others who may want to host a PACC may be support groups or business people to support their clients. All facilitators must be trained by Pulse and have been to at least 2 PACCs as a participant. PACCs last approximately 90 minutes, which includes introductions. Participants should pre-register. It's helpful to know who will be there, and we at Pulse can handle the registration process. Participants don't need to know each other. Attendees may come more than once, as they may learn each time they participate. With different attendees, we learn new things and can hear about different topics, some we may not get to at each session. To host a PACC, you will need a quiet meeting space, 8 to 12 participants, a table with chairs and pens and paper. At Pulse, we have some regular rules. Be present and participate. It doesn't help if you're an observer. Don't ask prying or personal questions. We suggest only clarifying questions. Use your own experience. We're looking for solutions that have worked. There is also no legal, financial, or medical advice permitted. What is said here stays here. Privacy is important and should be taken into consideration if family members are participating together. We discourage the use of names of medical facilities or clinicians, since there could be people happy with the experience they had when someone else was not. These are some of the topics. Have you ever sought out a doctor for a second opinion? How did you find that doctor? What do you bring with you to the doctor's office? What do you think is a reasonable wait time at the doctor's office? Have you ever walked out because you waited too long? And did you make another appointment? Other topics that can be discussed, if someone chooses, are about the healthcare proxy and medications. And if there's something not on the list that someone wants to discuss or learn about, there's a place to write that in. Here's how a PACC might look. Refreshments are welcome during introductions. And then participants will go to a table and individually review the topics of interest. As a participant, you might be interested in a topic because you're curious how others handle the situation, because you want to learn more from other people's experience, or because you want to share your experience to help inform others. You'll pass these index cards with the numbers written on them to the facilitator. There's no names on the cards. And then together we do a closing and we'll debrief about how it worked for you. Did we miss anything? Was anything not answered that is important to you now? At Pulse, we are dedicated to raising awareness about patient safety through advocacy, education, and support services. A PACC is about satisfaction, getting the most out of your medical care, and of course about your safety. Please call or contact us if you have any questions and see if there's a PACC happening in your community at www.patientsafetyevent.org.